Welcome back to The Explainer. Today, we're diving to a really fascinating intersection of the human body. We're going to connect the systemic health of your blood with something you literally see every single day in the mirror. We are demystifying anemia and revealing exactly how your mouth acts as a direct, visible window right into your circulatory system.
So, I want you to step into the shoes of a medical detective for just a second. Could your dentist actually be the very first person to diagnose you with a systemic blood disorder? I mean, most of us think of a routine dental visit as just, checking for cavities. But as we'll uncover today, the soft tissues in your mouth are incredibly sensitive to what is or maybe what isn't flowing through your veins.
Okay, let's dive into this. Here is our path ahead. First, the blood delivery problem. Then, why the factory fails. Next, when cells break down, followed by clues inside your mouth. Finally, we'll wrap up with fixing the shortage and the dental safety check.
Let's kick things off with Section 1, the blood delivery problem, and defining exactly what we mean by a shortage.
Anemia isn't just feeling tired. Clinically speaking, it's a measurable decrease in hemoglobin or your overall red blood cell volume. The World Health Organization sets a very specific baseline here. We're looking at hemoglobin less than 13 grams per deciliter in men and less than 12 in women. When your numbers drop below those thresholds, your body's oxygen-carrying capacity is fundamentally compromised. It's a real delivery problem.
To really understand how we dip below those numbers, it helps to know a little bit of the language. The root word erythro simply means red blood cells, and the absolutely crucial term here is erythropoiesis. Think of erythropoiesis as your bone marrow's factory creation process. So when you have anemia, something has gone seriously wrong right there on the factory floor.
Moving to Section 2, why the factory fails. Let's look at the functional classifications.
And this brilliantly illustrates the three main functional mechanisms of anemia. First up, we have hypoproliferative. Basically, this means the factory itself is damaged, or it lacks stimulation, maybe due to something like renal disease. Second, there are maturation disorders. Here, the factory is running, but the cells just aren't maturing properly because they're missing key raw materials, like B12 or iron. And third, hemorrhage or hemolysis. In this case, the factory is working perfectly fine, but you're losing or destroying red blood cells way faster than you can make them.
Now, one of the most fascinating ways this factory actually stalls out is through the anemia of inflammation. It's a really complex chain reaction. When you have a chronic disease or an infection, your immune system fires up, releasing a cytokine called IL-6. This tells your liver to pump out a protein called hepcidin, and hepcidin effectively locks the doors on your body's iron stores. The iron literally gets trapped inside macrophages, and your intestines just stop absorbing new iron altogether. Your body essentially hides its own raw materials, totally starving the bone marrow factory.
Section 3, when cells break down. Let's dig into the morphological classifications.
So doctors often classify anemia morphologically, which honestly is just a fancy way of saying they look at the physical shape and size of the cells under a microscope. The term chromic refers to the color, which is based on a hemoglobin concentration, so hypochromic cells are pale. Cytic, on the other hand, refers to the size. Normocytic is, you guessed it, normal. But the real medical clues come into play when those cells are either too small or way too big.
Now, what's really interesting about this slide is how different raw material shortages result in starkly different physical cell sizes. If you lack iron, which is the core building block of hemoglobin, your cells end up microcytic or abnormally small. But if you lack vitamin B12 or folate, you get macrocytic cells. Why is that? Well, B12 and folate are absolutely essential for DNA synthesis. Without them, the cell's nucleus matures way too slowly, the cell fails to divide on time, and it just keeps growing into this giant, inefficient cell.
As you can imagine, the root causes of all this are incredibly diverse. A simple iron deficiency might come from everyday blood loss or just a poor diet. But something like pernicious anemia, that's actually a lack of intrinsic factor in your gut, meaning you physically cannot absorb B vitamins no matter how much you eat. And then there's hemolytic anemia, which could be driven by inherited traits like sickle cell disease, where abnormal hemoglobin causes the cells to become inelastic and actually rupture.
Which brings us to Section 4, clues inside your mouth. The oral manifestations. Let's turn you into a medical detective.
When your systemic iron, B12, or folate levels drop, some really glaring physical signs start to appear right inside your mouth. Your dentist might notice atrophic glossus, which is a red, smooth, and intensely sore tongue. They might spot angular cheilitis, which is that painful cracking at the corners of your mouth. They're also looking for frequent oral ulcers, candidiasis or oral thrush, noticeably reduced saliva that leaves you with dry mouth, or just unusually pale mucosal tissues.
The biology behind this is absolutely striking. Iron, for instance, is absolutely essential for epithelial cell turnover. Your tongue is naturally covered in these tiny bumps called papillae. Well, without iron, those papillae literally atrophy and disappear, leaving the tongue completely smooth, shiny, and just painfully burning. Vitamin B12, on the other hand, is crucial for myelin. That's the protective coating on your nerves. A deficiency there leads to nerve demyelination, which causes this weird crawling, tingling sensation, or paresthesia, right there in your mouth.
Section 5. Fixing the shortage. Let's move to and see how this builds into the actual treatment and management.
To get that bone marrow factory running again, the treatment has to specifically match the missing raw material. For iron deficiency, it's pretty straightforward: 150 to 200 milligrams of oral ferrous iron every single day. For a folate shortage, just 1 to 5 milligrams of daily folic acid usually does the trick. But B12? B12 is unique. Because a lot of patients lack the intrinsic factor needed to absorb it in the gut, doctors often have to bypass digestion completely with an intramuscular injection every 3 months. Or alternatively, they give massive oral doses. We're talking like 1,000 micrograms, just hoping that a tiny 1% absorbs through passive diffusion.
Now, to know if these targeted therapies are actually working, doctors check something called the reticulocyte index. Reticulocytes are young, newly released red blood cells. You can think of them as the factory's newest delivery trucks. If the index is high, it means your bone marrow is working overtime to compensate for a shortage. But if you have anemia and a low index, well, that confirms the bone marrow factory is fundamentally underproducing and desperately needs help.
Finally, Section 6, the dental safety check. Let's talk about some strict clinical rules.
So, the crucial point is this: absolute baseline for safety, 10 grams per deciliter. This is the strict minimum hemoglobin threshold required for a patient to safely undergo any kind of surgical dental procedure.
The guidelines here are absolute. The medical literature explicitly states that no surgical dental procedure should ever be performed without first making a note of the complete blood count and hemoglobin values, period. Operating on an anemic patient without correcting those blood levels first can lead to really severe complications, poor healing, and a super dangerous susceptibility to bleeding and infection. It's a crucial safety net. This whole topic truly reframes how we view our oral health, doesn't it? Your mouth isn't just a place for your teeth, it's the gateway and a vital early warning system for your entire circulatory network. So, the next time you brush your teeth and look in the mirror, ask yourself, what might your smile be quietly saying about the health of your blood? Keep exploring, stay curious, and we'll see you in the next explainer.